Hi, everybody. So today I'm just going to briefly touch the highlights of the disorders in this chapter because they're pretty interesting and you might miss some details about them just based on reading the chapter itself. So these are the motor disorders, and we're going to be talking about disorders both of increased motor activity and of loss of movement. And we're going to start with Huntington's disease, or often called Huntington's chorea. It was named for George Huntington, who first described it. Both his father and his grandfather were doctors, and he studied the disease when he became a doctor. He wrote a description of this at age 22, so that might make you feel like you're behind. No test for me. But he just happens to be someone who found something out very young. Really interesting side note about American history. There was the village of Burns in England in 1630, where whole families are branded and treated as witches. And they sailed to America with John Winthrop. But they, of course, did not escape cries of witchcraft in America. Unfortunately, we also have a not so great history with that. And they have looked at the genetic basis for the disease by tracing family backgrounds back to those Winthrop passengers, and they think that they all had Huntington's. Which you can imagine, again, if you think about the symptoms of Huntington's, these strange movements and difficulties cognitively. Someone who doesn't understand what that is might mistake that for something like magic. So Huntington's is genetic, as we just established. It is linked to both those abnormal movements, which are called choreas, which again is why this is sometimes called Huntington's chorea, as well as intellectual deterioration and personality changes. And it begins as a reduction of activity and a restriction of interest in things. So it can almost feel like depression in that way. And then you start to have these involuntary movements. And these entail your whole limbs. And there's no pattern. They're irregular. One famous person who had Huntington's is Woody Guthrie, the musician. So as I was mentioning, the movements, that's all your limbs. It's irregular. You've got your head, your face, your trunk, which is like your torso, and your limbs as well, particularly arms, that are all involved. And in terms of behavioral symptoms, we've already mentioned the personality changes and cognitive impairments. And as I mentioned, depression, this can look like depression, feel like depression, but you can also end up with anxiety, with mania, as in bipolar disorder, and psychosis. So again, a lot of things going on. So what happens in the brain here is that the cortex shrinks and thins, and the basal ganglia, which I mentioned we talk about a lot throughout the semester, they atrophy and show neuronal loss. Anytime you have neuronal loss when it's not planned, it's problematic, right? So you basically got an imbalance in your neurotransmitters, which is very problematic. So neurons that are specifically related to GABA and acetylcholine in the basal ganglia are dying more than they should be. And so these people end up having poor performance on memory tasks, poor performance on frontal lobe related tasks, those executive functioning things. And this shows you just an illustration of what that looks like and why you end up with some problems, right? Because you're essentially missing a whole step in the process. Tourette's is something that's pretty interesting. I think that unfortunately it's been made comedic at times, which again is problematic, right? We don't ever want to be making fun of a mental illness or some sort of physical disorder, and Tourette's is really both. So that's problematic when people are doing that. But anyway, that is, again, sort of known in the popular media as the one word you shout and swear, right? But Tourette's is so much more than that. Tourette's It was first described by Georges Gilles de la Tourette in 1885, and his description is still remarkably accurate. So he got it right the first time. And in terms of this disorder, you end up with 3 stages. The first is the tics, the multiple tics. So there can be things, twitches in your face, your arms, this cries, the verbal things that we, again, associate with Tourette's. Those are usually the second things that develop. And then you have emission of articulate words added to those tics and cries. So sometimes this is echolalia, which is just repeating what other people say. This is also a symptom that we see in schizophrenia. And coprolalia is that obscene or lewd speech. And part of what goes on here is that disruption in the frontal lobe. We know the frontal lobe is related to inhibition, right? So stopping you from saying things you might want to say, but you probably shouldn't. So in Tourette's, it's like an extreme disinhibition, and those come out all the time. You see some statistics here as well for this disorder. So they think that, again, this is related to the basal ganglia. And in terms of how we might be able to treat it, there are anti-dopaminergic drugs, medications that specifically target dopamine. Those seem to be helpful most specifically. Things that look at or address norepinephrine receptors also seem to be helpful. Seems like there are some difficulties, particularly in the right hemisphere. These individuals will end up struggling on things like that complex figure drawing task that we talked about, and also sometimes they have a hard time remembering where things are in daily life. So here's where you can see where those difficulties lie. There's a lot going on here, right? And a lot of this sort of ties to what we just talked about with the agnosias as well as the movement disorders. So the next thing we'll talk about is Parkinson's disease. And Parkinson's disease occurs because of degeneration in the substantia nigra, and the dopamine in the brain is reduced to essentially nothing. And that's problematic because we know dopamine is related to a lot of functions as well as things like mood. Parkinson's was described by James Parkinson, who was a London physician in 1817. And he watched victims from a distance on the street of London. So maybe sketchy, he wasn't actually treating them, but often this is just called observational research and is considered ethical as long as certain precautions are followed. They have a variety of symptoms that can vary from patient to patient, and the symptoms can look like what happens to your motor activity as you age, but sometimes Parkinson's strikes people quite young, unfortunately. So there are both positive and negative symptoms. Now, one thing we have to remember in psychology, or you might not have even learned this before, is a positive symptom doesn't mean this is like a good thing in your life. A positive symptom actually means that this is something someone without this disorder would not have. So they are experiencing symptoms the average person wouldn't experience. And the negative symptoms, which we'll talk about next, are things that are lacking that a normal person would experience. So for Parkinson's, the positive symptoms are muscle rigidity. Sometimes this is described as cogwheel rigidity, where like instead of being able to do things in a smooth motion, it might be a little more jerky. Tremor. The tremor here is what is called a resting tremor. So, you might be talking and, not using your hand, and that's when it's tremoring. But if I were to grab something off my desk, then that tremor goes away. I put it down and it comes back, okay? I personally know someone with Parkinson's who has a tremor but can still play guitar because, again, it's that resting tremor. So plays guitar beautifully, actually. So certainly can make things pretty difficult. In terms of involuntary movements, we see restlessness, continual changes in that posture, as well as involuntary turns of the head and eyes from side to side. And postural disturbances. They're not going to sit in sort of a normal way. They might sort of have to hunch a little. So we talked about the resting tremor already, and the muscular rigidity here as well. Now, in terms of the negative symptoms, we have problems with posture. So disorder of fixation is the inability to maintain or difficulty maintaining a part of the body in its normal position related to other parts. But also they have problems with equilibrium. So they have difficulty standing or sitting unsupported. And this is related to the disorder of writing. So they have difficulty standing from a seated position. And difficulties with locomotion. So they have difficulty getting started walking, and then once they start, they experience what's called a festination. So essentially, it's like they kind of like lean forward as they walk. So they might start slow, but then they go faster and faster and faster, and it's like they can't stop themselves. And as you can imagine, that can be potentially dangerous for them. They do have some speech disturbance. There's a lack of tone in their voice sometimes. This is sometimes called prosody. And then akinesia, or a slowness of movement or a poverty of movement. So sometimes they have a blankness to their face. They may not blink as often as the average person. And sometimes they'll just sit motionless for hours. So it often begins with the hand tremor, and the face becomes mask-like and movement slows over the years. It rarely causes incapacitation quickly. It usually takes 10 to 20 years for that to happen. And it can be sort of happening and going away, happening and going away. What are the causes? Unfortunately, we don't really know. It could be genetic. It could be just part of the aging process, or again, sometimes they get it early, so not sure. Some people propose it might be due to a virus, which is interesting. There is a version of it that happens after encephalitis, but not everyone who gets it has encephalitis, so that's not this. You can get this as a result of drug use, so using major tranquilizers, contaminated heroin, environmental toxins. If it is drug-induced, the symptoms are usually reversible once you sort of filter out that drug from your system. The depletion of dopamine, again, is a symptom here, but it might actually be causal. We're not sure. And it can happen from other things as well. There's no known cure, but there's a lot of research going on in this area. Michael J. Fox is the actor who has this disorder and has been a big advocate for awareness, but also for trying to find a cure. Physical therapy, psychological counseling to deal with the physical and mental issues related to a diagnosis of this disorder. You can give them medications to increase dopamine or to block the cholinergic system. Those might help. The most promising research right now is stem cell. And that's controversial because unfortunately it's been politicized. Because some stem cells come from embryos that are created, really at that point they're zygotes, but not actually used in vitro fertilization, and people find that problematic. They are finding new ways to derive stem cells. So, for example, they might be able to take some cells from your hand and then convert that to a stem cell. It's an extra step, avoids the controversy. You might be able to also use what's called deep brain stimulation, which involves implantation of almost like a pacemaker in your brain. And again, combining that with medication. Your cognitive functions do slow down. And so this can look like dementia, and so it can be difficult to parse that out. And they can show symptoms similar to people who have a lesion in their frontal lobe or the basal ganglia in particular. they're impaired if you give them that voice intelligence test in general. And one of the things that they think might be related here is what's called a Lewy body. You see an image of it here. Lewy bodies are also implicated in a lot of other disorders and diseases. In particular, there's a type of dementia called Lewy body dementia. So I hope this is a little helpful, a little clarifying. And again, I highly recommend you go watch the videos that show individuals with these disorders. I think that is really the best way to get a feel for what it's like for someone who has to live with these conditions.